Good morning, everyone, and welcome to this week's episode of Tooth Teacher Tuesday. Today we've got another oral pathology corner, and um, again, we've talked quite a bit the past few weeks about things more or less related to saliva, some more than others. Um, as we wrap all that up, on today's oral pathology corner, I want to discuss something else that kind of ties into saliva, and that is something that to call it an oral pathology would be an overstatement because it is a very simple, non-concerning oral finding that many of us have, um, but it's something that to the eagle-eyed person they might notice and wonder if there's something going on. So without further ado, today's oral pathology is something called Fordyce granules. And what Fordyce granules are they're going to look, if you look in the corners of your mouth, you might notice these little teeny tiny pinpoint sized yellow dots. They're going to look a little something about like this. And what Fordyce granules are essentially sebaceous glands, which, for those unfamiliar, sebaceous glands are found on the skin. They help produce some of the oils that keep our skin naturally lubricated and functioning like it's supposed to. And what Fordyce granules are basically sebaceous glands that have kind of overstepped their boundaries, so to speak, that they've gone past the skin and just kind of barely wrapped around the corners of the mouths, past the cheeks, and into just that very inner lining of the corners of the lips. And so that being said, really like many of the pathologies we've discussed, not actually a pathology, just a finding, just an anatomical variation that some of us have, some of us don't. No treatment is involved with these. They're basically just inactive sebaceous glands that give the insides of the corners of your cheeks just a little kind of funny appearance. And even then, like I said, they're very small, pinpoint, so you may have had them your whole life and never noticed. But if you want to have some fun and play along, you can check and see if you have any of those Fordyce granules yourself. Whether you do or you don't, I thank you for tuning in to today's oral pathology corner. Pretty simple one, quick and easy, but it is, as of this recording, it's Memorial Day weekend, so keeping it simple so that I can get out there and enjoy the nice weather. Hope you are as well, and we'll see you on next week's Tooth Teacher Tuesday.